Seem like everyone is sick right now. Are your coworkers sniffling, sneezing, coughing? Chances are the call-off list is growing because the flu is hitting hard. It's considered to be widespread now in 46 states. And it's here too. Allegheny County, the number of confirmed flu cases has doubled from last week to more than 1,800 now. Westmoreland now above 650 cases. Washington not far behind. Local hospitals are struggling to keep up with the influx of patients. John Shumway joins us now live with more on that. John.
Yeah, those are some pretty big numbers, but it's really important to remember that those are reported, confirmed cases. And historically with the flu, the actual number of people who have the flu is way higher than those reported numbers. All of this is putting the squeeze on local hospitals just trying to handle the influx. In the emergency room of Allegheny General, they had 6 fresh confirmed cases of the flu before their second cup of coffee this morning.
We've had many flu cases. We're averaging about 8 to 12 cases a day right now in the emergency department.
And not all those patients are treated and released.
We've got 40 patients in isolation right now that have been admitted to the hospital, so it's become a huge issue.
Isolation means 1 patient per room, and beds are in short supply. AGH isn't alone. The Emergency Preparedness Hospital and Health System Association of Pennsylvania says in the 13 counties of Southwest PA, all of the hospitals are either full or close to being full. The flu is serious stuff.
It can become, a bad nuisance to some, but deadly for others.
I have a sore throat, but it literally just started.
Haley Donovan has a lot of company in her office.
I mean, I know multiple coworkers in my work right now have sore throats and can barely talk. They're still coming into work.
I can understand why some people come to work sick because I myself have done it.
Which of course fuels the flu rampage by spreading the virus through the air with every sneeze or touching a shared area. So how do you know when what you think is a cold is really the flu?
Sudden onset of fevers, chills, body aches, fatigue, night sweats people get with it.
And when should you definitely stay at home?
Fatigue, body aches, fevers, things like that. You really should avoid going to work.
Now, treating the flu is primarily treating the symptoms, keeping patients hydrated, and administering Tamiflu when the case is caught early enough. After a couple of days, really, Tamiflu isn't going to do much good at all, but they always use it for women who are pregnant or at-risk patients. Coming up new at 6, the best measure to prevent you from getting it or passing it on if you do get it. That's at 6 o'clock. For now, live at Allegheny General Hospital, John Shumway, KDKA-TV News.
John, thanks. As I mentioned a moment ago, the CDC says flu activity is widespread in 46 states. Health experts are predicting this flu season to be just as severe as the 2014-15 season, which was particularly rough. The H3N2 virus is the main strain making people sick this time around.